This is Brent of the Brookbush Institute, and in this video we're going over manual therapy techniques, specifically instrument-assisted soft tissue mobilization. Now, if you're watching this video, I'm assuming that you are a licensed medical professional with instrument-assisted soft tissue mobilization within your scope of practice. Now, there's some gray area here. Not every state has legislation around these tools. If you're not sure, check. I would hate to see somebody getting in trouble because they watched one of our videos and used it on a patient or client when things did not fall within their scope of practice act. Now, these tools, just like all of our other techniques, fall within a model of practice, and we are very big on assess, address, reassess. So even though these tools are specific to perhaps fascial tissue, we're still going to base their use on reliable assessments. We're going to use these techniques, and then we're going to reassess, and if they're not effective, we're not going to use them again for that particular patient or problem. In this video, we're going to go over brachial fascia and forearm fascia instrument-assisted soft tissue mobilization. I'm going to have my friend Yvette come out. She's going to help me demonstrate these techniques. I don't think you'll find these techniques very hard to do or very complicated. The hardest thing to do is with the arm. You're going to need one hand to move and stabilize the arm, which means we're probably going to use, for the most part, smaller tools or tools that we can at least handle with one hand. Now, we're going to start with a little bit of lotion here. And there's a lot of IASTM stobs out there who are very particular about which lotion they use and how much lotion they use and which tools they use and what strokes they use. And I think you guys have seen in other videos that I think way too much attention is paid to all that stuff. Like, you definitely need to use something on the arm. You want to be consistent with what you use so you get used to what it's supposed to feel like. Right, you can see here, I'm just kind of, this stuff that we're using, the Smart Tools cream, is very much like lotion. If I use too much, it's just going to build up on the tool as I go, which I can always wipe off on the towel or wipe off on somebody's other hand, right? It's just lotion. It's not a big deal. As far as which tools you use, these techniques will definitely work with a lot of different tools. I happen to like the Smart Tools the best just because they're really high quality. I like the edge on them, and they're fairly affordable compared to other tools that are out there. Now, the tool I like to use for the arm is the battering tool. We could use the scanner to start, which is what Smart Tools recommends, but I have a little bit of a problem with this very flat tool trying to match the very round surface of the arm. So even with my scanning, I'm going to go ahead and start with this. And what I'm going to do here, as I was kind of mentioning there, or as I kind of foreshadowed, is we start with scanning strokes. Scanning strokes are meant to assess the entirety of the arm, and then I'm going to keep a mental note of where I find any irregularities in the tissue, which for the most part are going to feel like more bumpiness or excessive bumpiness. So I'm going to start up here at the deltoid fascia, just work my way down. And that feels pretty good. Nothing there. All right. Go down this way. Maybe a little bit of something in there. All right. Now the tricky part. Got to use both hands. All right, so I'm going to go ahead and use my other hand to control her arm. And you guys can think of the majority of the brachial fascia is actually a tie-in to the pectoral, clavipectoral, and axillary fascia. So if I do this like I'm stretching her pec, it will add tension to the brachial fascia, like the sleeve of a shirt. It'll pull this way. So I can do scanning strokes. And guys, it doesn't matter which direction your scanning strokes are. All right, I feel a little bit up in here. We actually noticed that when we were doing the pectoral to anterior delt stuff. Be very careful as you go through the inside of the arm, right? You do have some nerves and an artery there. We don't want to just roughly scrape over those. Not that I think you could do a massive amount of damage, but it's not going to feel very good. And I actually don't feel all that much in Yvette's arm here. Maybe a little bit up here, right? And then of course for maybe the tricep, I can kind of get into one of these positions. Say mercy. No, not that hard, guys. Just turn over until to end range, and I can kind of pull through here. If I really felt some stuff on her tricep, maybe I would turn her prone, right? And then we could experiment with like a different position, maybe arm hanging off the table, right? Or maybe I could even have her sit up and face me, pull her arm across just find a position that allows you to add some tension. Now she really doesn't have all that much. I did find a little bit of abnormality kind of in her upper or proximal, medial, anterior brachial fascia. So I'm gonna go ahead and write that down, right? So right about this area in here, which, you know, we found some stuff in her pectoral fascia, so maybe this is just kind of a continuation of that dysfunction right through here. All right, so we'll address that. And the way we're gonna address this stuff is kind of in a three-pronged attack. I wanna disrupt any binding down of fascial layers, right? So we know that like when the inflammatory process happens, like we get collagen laying down in a disorderly pattern that could probably affect the amount of shear strain that's allowed between tissues. I want to break that up. I'm going to go in all directions. Fascia doesn't follow the direction of your muscles. So I'm going to start here. I'm going to be very careful because this is a sensitive area. And all I'm going to do is try to get a few strokes in each direction. All right. Maybe for the arm, these concave surfaces work better. You can see I'm using the shark fin tool here. And turn the tool around this way, right? Do some strokes up. You guys can see I went in one diagonal this way, then I'm going this way, and then this way. Right, and I could even go straight across, right? Almost like a cross friction sort of deal. Be careful as you get up here too. If you kind of strum the biceps tendon, that's not going to feel very good either. She did get just a little bit of petechiae right up in here. All right, and that's it. That's it. That's all the therapeutic intervention she needs for that one area. Now, after I've gone over the bicep, you know, maybe we're treating a vet for some lateral epicondylitis. So maybe I want to go over her forearm fascia. Same thing. I'm going to go through, do my scanning strokes, try to identify any abnormal tissue quality, and I actually notice a little stripe right across here. All right, maybe a little bit in there. How's that feel, Yvette? Maybe a little bit in there, but not much, not like the back of her arm. All right, I do actually have just a little bit in this area here. All right, again, if I was going to go after that area completely, maybe I would flip her over into prone so that I could attack, just like I would tricep, so I could attack it in a position where it's a little easier for me to stabilize her arm. But let's say I'm going to go after this little stripe here. I'm going to do the same sort of thing. I could actually use the rounded edge here to kind of, you guys can see it kind of fits perfectly right around her forearm. That works out pretty good. I'm just going to do some down strokes, and I kind of have an angle coming this way, and then maybe I want to get an angle going that way, and then maybe I'll go up in a couple different directions. Angled, angled, and then maybe pure up. Right, pure down. And with all this scraping, you know, and forgive me for not mentioning it right off at the beginning of the video, I'm at about a 30-degree angle, and I'm just pushing into the tissue enough to feel some feedback from the muscle. So I'm not trying to push through the muscle. The muscle is actually not my target. The fascia at the top of the muscle and the fascial layers above the muscle is my target. So once I get down to the muscle, I know I'm there, and then I just pull through. All right, so 30 degrees, only enough pressure to give some feedback from the muscle, some pushback from the muscle, and then there you guys have it. That's all the therapy we need for one little area. Now, a couple other things we can do. We can go after trigger points, and we can do some pin and stretch. Now, trigger points in the arm are actually fairly rare. To get an active trigger point in like the biceps or brachialis or triceps, or maybe the only trigger point that is actually really common is the extensor mass. So what I would do with trigger points is I tend to go and try to disrupt fibers in all directions around the trigger point. Now, trigger points are nothing more than dysfunctional motor end plates. I don't know if I'm actually getting desensitization with this, or if I happen to be getting a disruption of scar tissue and collagen that's been laid down due to the dysfunction of that end plate. But either way, what I found in outcomes, all right, she has a trigger point right about there. So I'm just going to go around in a circle with the edge of this shark fin tool. Right, I got a nice little edge there. What I get in outcomes is better carryover. I get less sensitivity in the next session. Trigger points tend to come back less viciously. We all know that like we do a treatment and we get really great results by the end if we've done a good job, and then they come in the next session and they've taken a little step back compared to the end of their last treatment. With stuff like this, I find that my carryover is a little better. I get less of a step back. And so I'll go after the trigger point there. All right, so that's good stuff. And guys, I'm not overly concerned about how I'm holding this tool. Hold it how you're comfortable. Try to get your 30-degree angle. Make sure you're getting enough pressure to kind of glide along, and experiment with different hand positions. If you want to use two hands like this, fine. If you want to use one hand and a different edge, fine. I suggest you use every tool in your toolbox until you find the technique that works best. Maybe you guys want to use the edge here. Kind of scrape around that way. Just make sure that whatever you're doing, you're trying to make it as comfortable for you and your patient, and you're reassessing after you're done to make sure that this was effective. Now, the last technique I'm going to show you guys, and Smart Tools does do a wonderful job of teaching this technique, is like pin and stretch with IASTM. It's just a great idea when you think about how these fascial layers move over one another and how they have to be able to like the superficial fascial layer has to be able to stay while the muscle fibers move all over the place. These pin and stretch techniques like pin the fascia and then make all the fibers underneath it move around. So let's say we go back up to here. What I would do is I would, 30-degree angle, get down to the muscle, and I'm going to pin. This isn't going to feel good, right? And I'm going to passively pull her through. Not that bad though. Okay, so as I mentioned before, it does help to know a little anatomy in this case, that the brachial fascia in this case is an extension of the axillary and pectoral fascia and even the clavipectoral fascia, right? So if I take her through kind of a chest stretch, I'll get some stretch over the brachial fascia. Now if I want to take this up a notch, what I can have her do is have her reach up that way, right, in the direction of my fingers. And I'm going to have you now go back towards the table in that direction, right? And I'm pinning, so this is active, and I can add overpressure. Oh, yeah. Right? And then if I wanted to get really intense, I can pin. You're not going harder with the tool, guys. I saw Event cringe there, and she was like, no, we're not going to go harder with the tool, but what we can do is have her go active with my overpressure as I pull the tool through the fascial layer. So now I'm like, I'm using opposing force with this tool as opposed to the direction she's moving. Now again, be careful how much therapy you give in one session. We don't want to add pain to painful conditions, right? You can bruise somebody. And like if I was treating her for either shoulder or elbow or wrist dysfunction, which is where I would use some of these techniques, then the last thing I want to do is do a great job improving her impairments, but then add a painful stimulus, which is a bruise that she's going to have to get over in the next week. We know kind of that centralization of pain and how pain works. That's not going to help our outcomes any, to add another more afferentation that is not positive, right? So you guys be careful. You don't have to do all of these techniques all in the same bout. You could try just the scanning strokes and disrupting any abnormal fiber, and then coming back and doing that plus pin and stretch. You could try doing the scanning strokes and just doing pin and stretch. You could try combining any two of them in the next session. And it might be a couple sessions before you feel comfortable with the patient and the outcomes that you're getting that you want to do all three of the things I showed you, which was the disruption of abnormal areas, trigger points, and pin and stretch in the same session. That's actually a fair amount of therapeutic intervention. Stay tuned for your close-up recap. All right, guys, so we're going to start with a little lotion here on our forearm fascia, specifically the forearm fascia over the extensor mass here. Let's say I'm working on some lateral epicondylitis. We know that the extensor mass has a tendency to get overactive, so maybe this fascia has a propensity to become dysfunctional, right, with some binding and maybe even some adaptive shortening via the Davies principle. So I'm going to get this lotion on the skin, make sure that we get the skin well lubricated because we don't want to abrade the skin. And now I'm just going to use my scanning strokes. I'll use my scanning tool here, about 20 to 45 degrees, go right up to the muscle. All right, so just as soon as the muscle or tendon gives me kickback here, and we're going to run along the entire fascial sheath. In fact, I could go all the way up the arm if I wanted to. Right, and I noticed there was a little bit of bumpiness here, a little bit of bumpiness here. Same thing, bumpiness here, bumpiness here. I'm starting to see a trend. Bumpiness here, bumpiness here. Right, so we got this kind of area in here, and this area in through here that maybe deserves a little extra attention, right? This is maybe where I'm going to focus on my multi-directional strokes to try to free up those fascial layers. So I'm going to go ahead and use this battering piece because I like how this matches the curvature of the forearm real well. Now what I'm going to try to do is I'm going to try to go in this direction, this direction, this direction, and then I'm going to go the other direction, right? So I'm going to go this way, and this way. Just getting as many directions as I possibly can. Probably 3 to 5 strokes in each direction. This is a double beveled tool, which means the tool is shaved down from both sides, so you can flip it over and get the exact same feel. All right, so that was about 20 strokes, and you can see that caused some redness. That's about all I would do there. We could go down to the wrist. We saw a little bit here. All right, don't push too hard. We're not trying to push through the tendons. Just up to the tendons. We want to get all the superficial fascial layers. All right, so now I've done my 2 areas where I thought maybe there was some difference in tissue texture, right? And I did all my different angled strokes, hopefully adding some mobility between those fascial layers. Now maybe I can use my shark fin tool. You know what, maybe I won't use my shark fin tool. Maybe I'll use this tool to come after the trigger point that I had found earlier in the extensor mass. We know this is a very common point for trigger points. Right, I'm just going in a lot of different directions. This is not a double bevel tool, so we kind of have to be careful here when we switch directions. Notice I switched sides of the tool to the double bevel so I could use my same hand. I'm not as coordinated with my left hand with these tools, I got to admit. I keep trying to get better. All right. Now once I've done that, we know last but not least, we might want to do some pin and stretch technique. And I didn't get to show this on the further out shot. So the way this works for the wrist is I'm going to start in wrist extension and just a little bit of elbow flexion. I'm going to pin down and then I'm going to pull down into extension and wrist flexion as I go down. All right, let's try that one more time. All right. All right, the hard part is to follow what you're doing with the tool. Now I could ask a vet to do this more actively. All right, so assist me now. And then I could add overpressure at the end. That would be a little bit more intense. And of course the most intense would be pin, her going active, me adding overpressure and pulling through. Right, and there she definitely has some stuff up in here. All right, one more time, down, and pull through. All right, and that's it, guys. That would be more than enough treatment for a vet. That's actually quite a bit. We did some 20 strokes for a trigger point. We did all the different multi-directional strokes here, all the different multi-directional strokes here, and 2 to 5 of those pin and stretch techniques. I think one of the mistakes I see most often with these IASTM treatments is people go overboard. They do like 10, 15 minutes on one area. It really shouldn't take you more than a minute, 2 minutes on any one area. And then it's probably time to do another technique. This is definitely one of those times where more is not necessarily better. If you didn't get the objective that you were looking for, right? Let's say you did your assessment, this intervention, and then reassessment, and you got no result. Maybe this isn't the right technique. Maybe the idea is not to just go more intense and see if you get an objective that way. You might be able to try that and increase the intensity a little bit, but I would not take that path of logic too far. You're probably more likely to do more damage, create bruising, and of course if we get bruising, we could add another painful afferent to this already dysfunctional system, and we definitely don't want that. So if you guys have any questions, I hope you enjoyed the video. Please feel free to leave them in the comments box below. So there you have it, instrument-assisted soft tissue mobilization. Make sure to assess, address using the intervention, and then of course reassess. And if you get the chance, these videos are not a replacement for live education. Of course, if you get the chance, you should take live workshops or find a mentor who's experienced using these tools, or maybe a friend that wants to learn them too, so at least you can practice on each other and give each other some tactile feedback of what you feel, how you felt the next day, what results you felt that you got. I hope you guys enjoyed this video. Please feel free to leave your questions below.